I would like to welcome everyone. Thank you for joining the Why the Eye, Making an Impact with the Stories We Tell session today. My name is Dr. Kevin Frick, and I'm from the Johns Hopkins Carey Business School, as well as the School of Public Health. I will be your moderator for today's discussion. Our panel for today's roundtable will discuss how data, social media, and patient advocacy can be used to tell a story around the importance of vision and eye health. And now I would like to introduce our panelists for this session. First, we have Dr. Patrice Hicks. She's from the Department of Ophthalmology and Visual Sciences at the University of Michigan. Second, Dr. Sila is a Cornea and Refractive Surgery Fellow at Harvard Ophthalmology. And finally, Christina Gill is a Global Family Coordinator at the organization called Know the Glow. Before we get into the discussion, a few housekeeping items are important. The roundtable discussion will be recorded and made available on the Prevent Blindness website. We will take questions from the audience and will respond to as many as time allows. Please submit them through question and answer button at the bottom of your screen. So with that as background, let's get started. I'd like to start the session with each panelist sharing a little bit about herself. So we will start with Dr. Hicks and we'll go from there.
Hello, everyone. I'm Patrice Hicks. My pronouns are she, her. I'm a woman in my 30s with brown curly hair pulled back into a bun and brown eyes. I'm wearing a black top with a black and gray cardigan, and I'm sitting in front of a University of Michigan campus background. I'm currently a postdoctoral research fellow at the University of Michigan in the Department of Ophthalmology and Visual Sciences, and I'm a health equity researcher in the space of eye care and vision health. I'm passionate about this field of research because of the health inequities I've observed within my community throughout my life. My current research focuses on how, where an individual lives can impact their eye and vision outcomes.
Thank you so much. And I forgot to do one important thing that you did, which is to say that my pronouns are he and they. I am a male in my 50s. I am against a background with some logos of our different values from the Johns Hopkins Carey Business School. I have brown and gray hair, yellow reading glasses, a blue jacket, and a red, white, and black flowered shirt on today. With that, I will hand it off to Dr. Ball for her introduction.
Thank you, Dr. Frick. Hi, everyone. I'm Sila Ball. I recently, as in the last 3 days, completed my Cornea and Refractive Surgery Fellowship at Harvard. It's very exciting. And I will be starting a Global Ophthalmology Fellowship through Moran Eye Center. I am a female in her early 30s. I have brown and blonde hair, hazel eyes. I'm wearing a light pink shirt, but more importantly, I'm wearing a necklace with an eye embedded on it. And my background is just a bright blurred background. I'm here to talk a little bit about the intersection of public policy, eye health, and social media campaigns. I've become pretty active on Instagram over the last few years since the start of the pandemic, and I'm really excited to share some of those stories with you all.
Thank you, Dr. Ball. And as an Instagram follower, I can attest to the fact that you have a very exciting to follow Instagram page. So thank you very much. And finally, Christina Gill, could you please give a little more introduction about yourself?
Thank you very much, Dr. Frick. My name is Christina Gill. I am a woman in my 40s. I am currently wearing a red shirt with some floral on it. I am sitting in front of a white background with Know the Glow logo. I have light brown hair and brown eyes. I became part of Know the Glow back in 2022 after my son Elias, who we call Eli, lost his eye to a rare disease called Coates disease. He was 18 months old at the time, and we were also going through a pandemic, as everyone knows. So I had to learn to step up and become his advocate. And also now I'm trying to inspire many of those around me to also be their own advocates.
Thank you very much. And again, I will allow or remind people that certainly feel free to use the Q&A. There you can also chat to us as the host and panelists if you have questions, but easier to put it through the question and answer so we can keep track. With that, I'd like to begin with Dr. Hicks. We're here today to talk about telling stories. So when you are, as a researcher, are using data to tell your stories, how do you use data to tell a story? And is there particular things that you feel it's important to be mindful of when you're using data to tell a story?
Yes, thank you. So as a health equity researcher, I utilize data to demonstrate associations between social risk factors and eye and vision outcomes. Specifically, my research focuses on the neighborhood and built environment and how related social risk factors impact eye and vision outcomes. So I use data to look at potential associations between these neighborhood level factors and various eye conditions. As a health equity researcher, though, I am mindful of how I present the data. For example, making sure I present how the data was collected for different demographic factors, for example, such as race and ethnicity. So was it self-reported by the patient themselves, or was the race and ethnicity collected from the electronic medical record, as this could potentially bias the data? I also highlight when the data may be limited, such as if there was limitation in the number of individuals that were included in a study, a research study that were from specific racial and ethnic backgrounds, as the findings may not be generalizable to those communities. I don't want to undermine advances in health equity that have been made, so I aim to be transparent on potential limitations of the research findings, and I want to make sure that my research and the data I present is purposely working towards eye health equity.
Those are important lessons, and particularly keeping the values and the objective behind the story front and center as you're developing the story from the data that you have. So next, I'd like to go on to Christina. We heard a tiny piece of your story in your introduction, and I'm sure that you've had to tell your story countless times. And so as you've told your story again and again, what have you learned in the process? And how, if at all, have you modified or enhanced or otherwise refined your story as you've gone along?
Well, I think one of the things that I have learned the most was taking a lot of the emotion out of the story, depending on my audience. So if I am talking to a friend or a family member or another parent that is advocating for their child, it is a little bit easier to add that emotion in because a lot of people can connect with that. But when you go to the doctors, you have such a limited time trying to explain what the situation is going on, and having to remove that emotion and just presenting the facts is actually what's going to help you get more to what the diagnosis is and help you get more to trying to find a resolution with the doctor as well. So as I've evolved through my story, I've condensed it over the time so that it's not a 30-minute speech, but also just really focusing it on my audience for fact and emotion.
That's insightful. Just a quick follow-up. I think when I hear what you're saying, I think about the need for empathy, even if you're not putting in a whole lot of emotion. Mm-hmm. And the essentially, it sounds like you've almost developed an elevator pitch for your story, as opposed to the podcast documentary-like version of your story.
Yes, absolutely. So yeah, that's pretty much where I go with everything related to Eli, and I hope that can help another family member that is out there advocating for their child, or even just a patient advocating for themselves.
Yeah, and I think, again, just to sort of bring it together, I think it's important, as you've said, to really think about your audience each time you tell the story, and what do they need to know, and what is going to help you get to the resolution you need with a particular audience. So going on to Dr. Ball, you have over 26,000 followers on Instagram, and as I mentioned, I'm one of them. So when you think about social media and what social media can do and how it can be used to make an impact in vision and eye health, what do you think of? Why social media rather than other forms of communication for you?
So first of all, huge honor that you follow me. That makes me so happy. I hope you really, truly are enjoying it. But I just have a funny little segue story. And that is that until the pandemic, so until March of 2020, I was very anti-social media. And I would lecture all of my friends and family on how social media is degrading the fabric of society. It's mushing our brains. But then when the pandemic isolated us, especially healthcare providers, especially residents and trainees in the hospital on the front lines, my husband and I were really looking for a way to connect, not just with our patients, but with other healthcare providers, other medical trainees going through the same thing. And social media, when used properly, has this incredible ability to connect us with people, not only in our own neighborhoods, but halfway across the world. So we were able to share stories, and it started really organically, first with other healthcare providers, other medical trainees, and then you were able to reach an audience that was bigger and bigger to include patients, family members, friends of family members. And it gives you this connection that I don't think any other medium has the power to do. So again, with the right message and with the right tools, you have a very broad audience and you have a chance to authentically connect with people that you may have never met before.
That's so important. And obviously one of the main goals of storytelling for communication is connecting. Sometimes it's educating, but sometimes it's just connecting and building a community where people can exchange ideas and think about things together. And I agree that social media lets you connect with people you never knew would be able to connect with otherwise. And B, it's quite interesting sometimes that somebody will follow you for a very long time, never make a comment, and then you'll meet them in real life or on some random post one time, they'll say, oh, I've been following you for a very long time, and this is the first time I've commented. And
Yes.
So, you've got 26,000 followers. I don't know how many have actually responded directly to you, but it's fascinating to think about how each of those followers is taking little pieces of information, incorporating it into their thinking, incorporating it into their own advocacy or their day-to-day lives, and how you get that feedback to keep going and telling your story over and over again.
It's the one thing that I always worry about with such a broad audience is, am I making a meaningful contribution or am I just adding to the noise, which I never want to add to the noise. But sometimes to build those connections, you really do have to be authentic. So I'll post lots of videos of my cats. I'll post things that I'm going through that aren't necessarily this positive, bright light that people are looking for, because I believe that if we're honest and if we share our true selves, then you are able to curate an audience and curate a community that is there to share those same values with you. So it is a careful balance between oversharing and undersharing and making sure that you're adding meaning to people's lives. But I've been titrating this for a couple of years now. I get it wrong sometimes. I get it right sometimes. I try to answer everyone that I can. It's impossible, especially with our hours, to respond to everyone. But I usually see most of the comments, and as long as they're positive, sometimes I get some negative feedback, but mostly positive. It really does reinforce this sense of community that I'm hoping to build.
That's wonderful. And certainly I do most of my posting on LinkedIn rather than Instagram, but I know that as you described, being your true and authentic self is the best way to share your story, because then people know exactly who you are, and you can then, as you say, curate and find that group and community. So one quick follow-up question from the chat before we go on to our other questions. We have a Victoria Sheffield, very well known in the vision care area, but asking, why Instagram, and are you on other platforms?
Hi, Victoria. I can't wait to see you in September. Thank you for your question. Victoria is a dear friend and mentor to me. So why Instagram? It happened kind of organically again. It was the platform that as a millennial, I was most connected to. I felt that LinkedIn was a little too professional in the sense that people would just showcase their CV, essentially all of their accomplishments. And it didn't feel as authentic to me, and it didn't feel as warm to me. And so Instagram had this ability to really connect with the individual that I think LinkedIn didn't have for me personally. Facebook is a little outdated. I'm sure most people have heard that at this point. So there aren't as many users in my demographic on that platform. And I have thought about, joining Twitter, doing more on TikTok, but ultimately, if you're going to pick one, then I would pick the one where you have the most, where you can have the most meaningful impact rather than spreading yourself thin across many different platforms.
That's great advice, not just for social media platforms, but for life in general. And with that, the next question, and this is open to any of the panelists, how sharing either your story or a story about the work that you're doing, do you have any idea of how it's impacted those around you? Do you have an example and maybe either impacted those around you or created a ripple effect from the story that you've told?
I can answer that one first. But when I first started with Eli, I started a campaign called I Fight for Eli. And although I'm not like Dr. Ball, I don't have millions or thousands of followers. I have just a few hundred, but I was able to reach with hashtags people globally about Coates disease. And I would have parents reach out to me and ask me and say, hey, I took this picture of my son or my daughter, and I noticed this glow. What's your opinion? Now, I'm not a medical doctor, and I always do tell people that I'm not a medical doctor, but I was able to encourage them to get their child's eyesight checked. So I think within one of my very first posts, I had talked to over 10 families globally and encouraged them to get their child's eyesight checked. And through that, from what the follow-ups I did get, I think 4 or 5 of them did have some visual issues that they would not have detected without taking that photo of their child.
That's wonderful. Either of the other 2 panelists have an anecdote to share?
I'd be happy to go next. So I would say about 5 to 6 years ago, when someone would ask me about my research interests and what I saw my career as a vision scientist as, or what I wanted to look like, I would reply that I, wanted to dedicate my career toward to being a health equity researcher in the space of eye care and vision health. And sometimes my response would be met indirectly or directly with, that's great, but what's your quote unquote real science, or what are your other plans? And so I'm thankful for other health equity researchers in the space, including Dr. Kristen Wanyu at Yale, Drs. Angela Elam and Drs. Paula Ann Newman-Casey at Michigan, who have been successful in this space as health equity researchers to make an impact in working towards health equity in eye and vision. And I hope that my story, through both my lived experiences as well as my research path, can show future vision researchers and clinicians that are interested in the space that they can also be thoughtfully a part of the conversation and also be thoughtfully a part of this research. And I also hope that the research I conduct and the findings from my research can be part of the conversation, incorporating health equity content into education for health researchers, clinicians, allied health professionals, and the public within the community.
That's very informative, and really thinking about, again, how to make sure that your story is getting out there and people take you seriously for the work that you're doing. Not that any PhD would ever not be taken seriously, but how to frame it in a way that makes people understand what you're really working on. Dr. Ball, do you have something to share on this one?
I have a lot of stories that I share that I feel some of them are really well received. I think the main point that I like to get across is twofold. Number one, I use my platform to share things that I see as a physician that I know are affecting patients. And so even if that means sharing a really gory photo of a corneal ulcer that caused a perforation, I try to be as open and honest with my user or my platform as possible so that people can see the reality of what it means to sleep in your contact lens. What does it mean when you have a corneal ulcer? How can you prevent that from happening? And just give as much education as possible. And then number two, I like to use my platform to share advocacy updates. So whether that be, what we do with the American Academy of Ophthalmology in Washington, D.C., or what we do through the work of Prevent Blindness, so that my colleagues in ophthalmology, in optometry, are updated on what we're doing on the ground and can become involved if they would like to get involved. And I think that's the best way for us as physicians to increase our reach, is to talk directly to patients in a way that seems like you're talking to a friend or a family member, and then also to talk directly to our colleagues in a similar manner. Hey, this is what's going on. This is what we're working on. Please get involved. Please support this.
That's great. And again, it comes down to how are we communicating? What are we communicating about? And what are we giving people credit for being able to understand and comprehend and want to learn about in what we share with them? So it's interesting to hear about the types of stories that get shared and how they have immediate and ripple effects. And I know, in any storytelling that I do, professionally or personally, you always want that wow factor to really grab people either at the beginning or the end, or preferably both. And so, when you're telling a story, how do you make sure that it has a wow factor to get people's attention and keep people's attention? And again, it doesn't matter what order the three of you jump in on this one.
Okay, I can go because I have had a few wow factor posts. I think, we are inundated with information all day, every day. We're tired. I'm tired. Everyone on this call is probably also tired. So when you're consuming information, you want it to be engaging. You want it to be funny. You want something that stands out amongst all the noise. So if you are trying to share a story, I would encourage everyone, we've already talked about this a little bit, but to really try to be authentic and honest, because we are very good at reading through people that are too polished or that are putting content out there that they don't believe in. So number one is authenticity. Number two is think about what you would like to see. So when I made the corneal ulcer video, which I talked about in the last question, I showed it to my husband, who, by the way, is an emergency medicine physician, sees probably worse things than I will ever see. But when I showed him the photo, he was immediately squeamish. He didn't want to look at it. But the reality is that I see those patients every single day who use contact lenses inappropriately and develop these severe eye infections. And so I knew that that would catch people's attention, and I knew that it would allow us to advocate for change at the individual level. So I think it's okay to be a little bit spicy. You have to, walk a fine line, obviously, but just remember, as long as you're authentic and as long as you're understanding that your audience has a very limited attention span, just playing to that will allow you to really have that wow factor.
Capturing attention. That's the main thing.
Yes.
And you can do
capturing
it
and holding.
Right.
Exactly.
Yes. And you can do it visually given what you're seeing.
Yes.
Patrice, how about you? Anything that you have advice on for this one?
Yes, so my is somewhat similar. So visually, as I mentioned before, my research focused on where a person lives can impact their eye care and vision health outcomes. So when I'm asked to present my research, which usually utilizes large data sets at these nationally represented levels, I like to show both my exposure variable and outcome variable of interest within that geographic region. So for example, if I'm asked to give a talk at the University of Michigan, I may present my data of the exposure variable and outcome variable within that geographic region. So I might, I think I have a slide. So that is actually showing a study I did on historical redlining as the exposure and the outcome of visual impairment blindness. So I like to provide maps and talk about these exposures and outcomes for the metropolitan areas that other audience members may be familiar with. And so when I've given other presentations in other cities or geographic areas, I'll use a map within that area. And I can actually see, like, when I mention these different cities, I can see that many of the audience members are familiar with these areas. And I can see them making these connections that the eye inequities are occurring within the areas that they work and live and are impacting the communities close to home. So I believe it allows for a greater connection to the research findings and creates less of an abstract concept and makes it more personal to the individual, that they're actually able to visualize it or know about the areas that I'm talking about.
That's great. And certainly, I don't do a whole lot of research with mapping like this, but I would imagine the technology has developed over time to make this particular form of presentation easier and easier over time.
Yes, and it's easier to also locate a specific area, so I'm able to grab that data and just utilize the data from that specific either state or county or city and get it. This is actually at the census tract level, so even smaller granular levels.
Much appreciated. And Christina, how about you? What do you do for your wow factor?
So to kind of piggyback off of Dr. Ball and Dr. Hicks, I actually use a lot of the authenticity in the presentations that I give as well. And by being my authentic self, I can still have my facts without the emotion, by presenting and showing somebody what I've had to go through and showing them that physical journey that we've gone through. So whether it's using the photos of my son throughout our journey, and then also one of the biggest disparities that I did encounter when we were going through everything was actually trying to find medical care for him. Where we were living at that time, I was driving 4.5 hours just because I saw a glow in his eye. And even prior to all of that, where I was living, I wouldn't even have an eye doctor that would see him because he was under the age of 5. So being able to present that to somebody, they are able to connect to that without me adding my emotion and my frustration of being like, all of these doctors, nobody would see me. And I didn't want a diagnosis. I wanted to know if I needed to get to a hospital. It just makes a totally different impact when I tell that.
Yeah, that's interesting. And I know, and thinking about the use of pictures, I spoke to a bunch of high schoolers last week, and I don't have pictures in the same way, but even just pulling stuff off the NEI's website, this is what vision with certain conditions looks like. And I can certainly appreciate your need to drive far. My mother-in-law didn't have to go quite that far. She lives near a small city, but where a large state university is located. And she had to drive, 90 miles just to get a retinal hole fixed, because while the state university is there, it doesn't include a medical school. And so there were no ophthalmologists locally to her who could deal with something as simple, quote unquote, as a retinal hole to fix. So it's interesting to hear what the different wow factors are. And all of them sound like they are great ways to get and keep people's attention to listen to the story that you tell. So all of you have been very successful at storytelling thus far. I'm sure you've got an idea of what comes next, though, and where to go from here in terms of your storytelling. And if there's any particular stakeholder group or individual you would still like to reach. So Dr. Hicks, why don't we start with you on this one? Is that what's next? And does that include a specific new stakeholder group, individual, patient group? Who is it that you're trying to reach that you haven't been able to reach yet?
Yeah, so for the future, obviously, I want to continue to do health equity research in the space of eye care and vision health. And the neighborhood and built environment, which my research currently focuses on, is just one of the social determinants of health domains outlined by Healthy People 2030. So there's social and community context, economic stability, healthcare access and quality, education access and quality, and then the neighborhood and built environment. And so there's still so much work to be done. But my goal is to make, a dent towards achieving the eye health equity. And I believe my current research and my future research can help to inform change both upstream and downstream. So upstream, I'm hoping that by identifying these social risk factors such as housing insecurity, residential segregation, and lack of neighborhood resources, that are associated with eye care and vision outcomes, that I can provide policymakers with the needed data to create policy and inform policy that will impact social terms of health. And then downstream, I hope that my work can inform clinicians, researchers, and healthcare social workers to be able to do social risk factor screening, to connect individuals with resources, to assist in aiding and providing these resources that can help impact both their ability, patients' ability to utilize eye care and improve vision health outcomes. So upstream and downstream policy, as well as in the clinics and in the community.
Great. So you have a huge vision for what the future holds for you, which is a wonderful thing to have, and just take it one step at a time. Christina, how about you? What's next? And is there a group that you're still trying to reach you haven't been able to reach yet?
So we are, for Know the Glow, we are definitely expanding globally. And it's just been amazing of where our message is being touched right now. So we definitely are still expanding, and also bringing a lot of that still to the home front here in the United States. Looking at eye care for children under the age of 5. I mean, it's actually very disappointing on the fact that these children, they're being missed. I mean, we're lucky if they get a preschool screening, or if a pediatrician actually does check the red eye reflex. So that is one area that I really, that we focus in as a group. But recently this year, I started something called Beyond the Glow, which is a subchapter of Know the Glow. And that was from one of the issues that I kept encountering with my son, which was that he was a child that could not communicate with me. And he's still, I mean, he's only 3 at this age. So he has a very limited communication, and trying to find out how to take care of a prosthetic eye. How does it feel? You know, what am I looking for? And I've caught myself in a panic on certain days and certain nights because I don't know what I'm looking for. And trying to find information on that is very hard unless I try and go to like a retinoblastoma site that talks more about eye cancer, but that's not what he had. So I ended up creating Beyond the Glow, where I'm putting together a ton of resources for parents who have made it now to the other side of the glow and possibly enucleation. And how does life look for us then as a parent or as a caregiver for these children? So that is primarily where I'm putting my focus. And further down the line, I actually would like to start working more and trying to change some of the insurance companies' views on the eye care world. You know, going back to the wow factor too. I mean, prosthetic eyes, I talked to my health insurance company, which is a major one. And when I was asking about the prosthetic eye, they asked me on the phone why I could not go down the street and go into the medical supply store to get him one. And I was beyond like floored that happened, but it just shows me that there is not enough education that actually really needs to be out there.
That last point is a great one. And, you know, I'm sure Prevent Blindness could have another whole session, not in this one, but in the future, about the disconnect between eye health and the rest of healthcare, many times, both on the health insurance side and sometimes on the healthcare provision side, that your story really does help to illustrate and make an important point about. Dr. Ball, how about you in terms of what's next and where you want to go? 100,000 Instagram followers or something other than discounting numbers of followers, I'm sure.
Yes, I would say I've tried to detach myself from numbers because it really isn't meaningful at the end of the day. But I was listening to a podcast recently and they were talking about the concept of what would you do if you knew you wouldn't fail? But then they flipped it around and say, well, what would you do if you knew you were going to fail, but just for the process of doing it and going through the process of doing it? And so I think for me, that was a really important question, and it can relate to social media. It can relate to your career. It can relate to your personal life, whatever it is. What would you do if you knew you were going to fail? Would you still do the things that you're doing? And so for me, I think I hope to use this platform to educate, to advocate, but more importantly, to find ways to fundraise and find support for global public health and global outreach. I think, you know, we talk about eye health in the United States and how underfunded it can be, and that's true, but that is even more true across the world. And I really like to think of our community as one humanitarian community made up of smaller but equally important parts. And so global health starts in our own neighborhoods, as Dr. Hicks is working on, and expands all the way across the world. So if I can find a way to use my voice to help to continue to perpetuate that thought and that meaning, that would be something that I would do, even if I thought I was going to fail. So
that's amazing. And I don't know that I've heard exactly the same podcast, but I've definitely heard some type of podcast or read something with those questions. And it really does force us to think about why we're doing what we're doing. So before we do the last question that we have in advance, I'd like to remind everyone that all the presenters will have a chat session afterwards, and the link has appeared in the webinar chat, so you can follow that when we're done. But the last question that we have before we go into some questions that people attending the webinar have submitted is, for each of you, any advice that you may have for fellow parent advocates, researchers, public health and healthcare professionals, particularly when it comes to how to better tell stories to prevent, identify, treat, and mitigate anything having to do with vision loss and blindness. What can each of us do better? How can each of us find hope in doing this? What are some things that you would share with other people like you who want to tell their stories as well? And why don't we start with Christina this time?
So I think, like I said, working on your elevator, pitch and story, how taking out that emotion a little bit and having the facts to be able to present to your medical professionals as an advocate as well is sometimes, I know more about Coates disease than a lot of my doctors that I have talked to, and I spend some time educating the doctor on it. And that's not the only one. I mean, there's diseases and, things outside of the eye world too, that I've had to educate the doctors on, but I know my facts and I'm able to direct them to those facts as well, and for them to do their research. So I always look at everything as a learning opportunity. And I don't get intimidated very much by other people, because we are all humans and we all have flaws and we can't all possibly know everything. So I think, for me, it would be to encourage another advocate to not be afraid to stand up and ask and to tell your story, but also learn and try to understand what your audience is so that you are relaying that story the best way that you can.
I appreciate the addition, your reiteration of the point about coming up with the almost pithiest version of the story you can sometimes to make the point very directly, but also don't be afraid to ask. The worst somebody can say is no, but hopefully they will say no, but I can refer you on to the next person who might be able to help you. And even if they do say no, remember to dig and say, but is there anybody else who might be able to help me? Can be quite an important part of the storytelling process as well. Dr. Hicks, how about you?
Yes, I would echo everything that was previously mentioned, but trying to make that connection. From my personal experience, I can say that doesn't always happen, but I think in most cases, if there is a connection that can be built upon, your audience may be more receptive to what you're sharing with them. As I mentioned earlier, I talk about geographical areas that my audience works and lives in relation to my research. And I think that helps to make it more memorable to the audience. And I think this also means that you can also try to tailor your message appropriately to your audience. So I have done some advocacy work in the past where I've met with senators and Congress individuals and just trying to see what, their outcomes are and what they're trying to do with their plans. And so seeing how I can tailor my message that may inform them more on the eye and vision research. And I also think you probably get more engagement by talking about, going back to my research, talking about a city, town, or neighborhood that an audience knows about rather than a geographical area that may be unfamiliar to them. So I think making that connection is key and tailoring it to your specific audience, as Christina had mentioned.
Great. And Dr. Ball, how about yourself?
So, this is a loaded question. I think we talked about it pretty extensively, and I agree with Dr. Hicks and Christina, but I think the one thing that I have learned is that to be a good storyteller, you first need to be a good listener. You need to find out what people are experiencing. And this is true for physicians. This is true on social media. This is true across the board. Are you listening to what people need or what they understand or what they're looking for? And if you can figure out what that is, then you can tailor your story to be able to better serve whoever you're hoping to reach out to. So that would be my biggest piece of advice. But I also just want to say that I get a lot of questions about how do I get started? What should I do first? What are the steps? And really just start. And it doesn't matter if you fall on your face and fail or if you're embarrassed. I mean, sometimes I look at some of my old posts and I just think, oh no, who posted that? But if you don't try and you don't put yourself out there and you aren't vulnerable, then you're not giving people the opportunity to get to know your story, to get to know you, and to get to build that relationship. So just put yourself out there. Hopefully nothing bad will happen, and something great could happen.
That last piece of advice is a wonderful one. Just try it, see what happens. Obviously, you might want to put a little bit of boundaries on vulnerability and things like that, but obviously just trying. And I think the other one of the other points that you had made about listening, the key is not just ask the questions, but truly listen to and try to understand the answers. If I could give you $1 for every time I've read recently in a business publication, don't just ask your employees, team, whatever questions, but truly listen to the answers they're giving. I'm like, why do we have to remind people of that? But indeed, it's value in asking, but the true value comes in hearing, interpreting, and really then figuring out how does this response either confirm or change what I have to think as I continue to tell my story and be an advocate. So that's great. We have a few questions that people have put in the Q&A box, and I'm going to go through those and certainly welcome people to continue. And as mentioned, our presenters will be in a chat afterwards, separate chats afterwards, if you want to follow up with them if we don't get through all the questions. So the very first one that we got was, and I'll throw this open to all of you, and maybe we'll just take one or two answers and then try to get through as many of the questions as possible. But the first one is, do you have any examples of successful public health campaigns on social media that have used data and patient advocacy to promote eye health? So what are some actual winning stories that we have in the eye health world on social media?
So I think this is a really difficult question to answer because directly correlating the social media campaign to the outcome is essentially impossible, right? You can't say that the correlation is the causation, which we all learn over and over again in undergrad. But I think that, first of all, Prevent Blindness does a phenomenal job at advocating for patients, at advocating for eye health. And they have different campaigns throughout the year, different webinars that we promote through social media. Similarly, the Academy every year has campaigns, whether that be during the start of the war with Ukraine, educating people about the impact that war has on eye health, or even just here in our own neighborhoods, 4th of July, most of the physicians that I follow, the ophthalmologists that I follow, posted something related to being careful with fireworks and how a firework injury can lose eyesight, lose fingers, things like that. So it's broad, but to be able to point to one, I think is a little bit difficult. I don't know if any of the other panelists have any input on this.
I certainly go ahead.
Sorry.
Go ahead.
I would say that, for Know the Glow, one of the things that we started was, I think it was a couple of years ago, using Facebook and using the paid advertisements. And we would make them very country specific when we were targeting a specific country that we were trying to reach. So one of the first ones that actually took off was in India. One of our marketing strengths that we have is that we use children that are in that specific area to help connect the audience, so that we can also provide resources. We have perfect translations. We spend a lot of time, money, and our resources. Everything goes to these campaigns to help reach these families. And Megan Weber, who started Know the Glow, just got a news alert on her computer one day, and they had a Prevent Childhood Blindness retinoblastoma march in India. And when she looked at it in the very back, she could see our Know the Glow logo, and people had wrote it out on these signs. And so when we then promoted that and on Facebook, we reached so many people. I mean, hundreds of thousands of people that we reached. And that really showed us that this door can open into the global world just with using social media. So
that's wonderful. And Dr. Hicks, I don't want to cut you off. Anything you want to add to that one, or are we good?
I think we're good. I think social media, though, is very good for disseminating data, even like to other clinicians in the field, just getting out there, sharing it, and putting it out there.
Yeah, and I know in some international work, not that I've done, but I've seen other people, messages about myopia seem to be getting out there in some countries. I haven't seen so much in the United States, but again, that's an example of where people might actually be at least beginning to change their thinking about preventing and controlling the progression to the degree that we understand how to do that. The next one was directed to Dr. Ball, but I think this really could go to anyone because you've all had the chance to use social media, even if you're not quite as followed as Dr. Ball is. But the question is, how do you make sure content is reaching the right audience to know they're getting the actual message that you're sending? This person says they just finished 5 years of optometry training, and one thing that they think is a problem is how the patients get information from the internet, and it can be hard to manage patients who have gotten misinformation from the internet.
This is a great question. And I think especially during the pandemic, it was very challenging for me personally as a physician to balance some of the misinformation. I will say that related to eye health, I try to be supportive to my patients that come in with Dr. Google and say, listen, I think I have sebaceous cell carcinoma of my eyelid, when really they just have a sty. And I try to explain to them why I know that it's a sty, what I'm seeing on exam, what my experience is. But in terms of reaching an audience on social media, you can use a search engine optimization strategy, or on Instagram, just simple hashtags to hashtag what you think your target audience would be interested in. So for example, for me, I use hashtag ophthalmologist, eye surgery, eye surgeon, things like that. Other ways to make sure that you're reaching maybe a broader audience or people that you're interested in is to work on building that community. So when someone comments on your post, respond to their question. However, with the caveat that if you get asked a medical question, I never through social media give any medical advice, and I just make that clear, and I'll say something very kind like, you have a valid medical concern, I just cannot give medical advice over social media, please reach out to your local doctors and they would be able to help you with that, or something simple like that. But just trying to build that community will allow you to grow and develop an audience that is targeted towards whatever niche you're building.
Thank you. And since we have just a little over 2 minutes left, one question to all of you, again, just real quick answers. How do you concentrate on the accessibility of what you're putting out for social media? Because that's a question that came up in a number of forums on our Q&A.
So I actually am very sorry that I don't do anything extra for accessibility. And I think that this is a great question. And I'm so glad that it was asked, because I need to figure out how to change that. And this is something that I think we should all be very mindful of, is knowing when we're not doing what we should be doing and accepting it immediately and then changing it. And then that's it. That's all it takes, is just someone pointing it out to you, and you let your ego down and you say, this is a really great point. I wish I knew this sooner, but I know it now and I will change. I think there's a Maya Angelou quote, and it's like, do the best you can until you know better, and then do better. So I will certainly do better. And hopefully next time I'm on one of these calls, I can tell you all the accessibility features that I have activated on my social media account.
Any other quick comments on that? I think that is a very good point, and understanding even what the tools are that are available to make things more accessible if we haven't thought through that before. Well, great. I want to make sure that we have just time before we finish up to thank all of today's panelists for joining us.